Good evening to all. I am Dr. Indu and my topic for today is carcinoid tumor. The word meaning of carcinoid is cancer-like. As you all know, the carcinoid tumor is a neuroendocrine tumor. As the name states, the origin of the neuroendocrine tumor is from neuroendocrine cells. These cells have two functions, nerve function and endocrine function. They secrete hormones like serotonin, bradykinin, histamine and so on. Neuroendocrine cells are mainly seen in the GIT and the lung. They can also be seen in liver, kidneys, pancreas and ovaries. Most common site for the neuroendocrine tumor is the GIT. And in GIT, the most common site is the appendix. Now, let us see the clinical features. Most of the carcinoid tumors are asymptomatic. But when they metastasize to the liver, they produce a group of symptoms and then it is called carcinoid syndrome. The symptoms mainly depend on the location of the tumor. If the tumor is in the GIT, it can cause abdominal pain, diarrhea, rectal pain, bleeding, etc. If the tumor location is in the lung, it can cause hemoptysis, chest pain, wheezing, breathlessness, flushing of the skin, etc. When there is a carcinoid syndrome, these symptoms can be aggravated. There will be flushing of the skin, especially the face, severe breathlessness, severe diarrhea and so on. This is due to the serotonin released from the liver. Normally, serotonin is metabolized to 5-hydroxy-indole acetic acid in the liver and excreted into the urine. There are some genetic syndromes associated with this carcinoid tumor. They are multiple endocrine neoplasia 1, neurofibromatosis type 1 and tuberous sclerosis. Now, how do you diagnose this condition? In the blood, we will check for chromogranin A and serotonin. In typical carcinoid, both of this will be elevated. In the urine, we have to check for 5-hydroxy-indole acetic acid. In a typical carcinoid, it will be elevated. In atypical carcinoid, what are the findings? In atypical carcinoid, serotonin will be high in the urine. Along with serotonin, 5-hydroxytryptophan. We have to be careful. This is 5-hydroxytryptophan will be high in the urine. Now, let us see the gross appearance of the tumor. This tumor is normally brown in color, which is due to lipofuscin. In the microscopy, what do you see? There will be fine stippling of the chromatin, which is called, this appearance is called salt and pepper appearance. There will be granular eosinophilic cytoplasm. And the neurosecretory granules are seen inside the cytoplasm. The tumor markers like chromogranin A are in the neurosecretory granules. And what do you see in electron microscopy? In electron microscopy, we can see dense core granules. And these dense core granules are nothing but the neurosecretory granules. And when we are diagnosing the carcinoid tumor, we talked about typical and atypical carcinoid. In a typical carcinoid, in the microscopy, there will be no necrosis and there will be less than 2 mitotic figure per 10 high power fields. But in atypical carcinoid, there will be areas of necrosis and there will be more than 2 to 10 mitotic figures per 10 high power fields. Now, what are the imaging modalities which can be used to diagnose carcinoid tumor? We can use CT scan, MRI scan, octreotide scan, gallium scan and so on. What about the treatment? The treatment is mainly aimed at reducing the hormones. We can use somatostatin analogs. We can reduce the stress level, decrease the alcohol consumption. The mainstay in the treatment of carcinoid tumor is surgery. Thank you.